Hello classmates, welcome to the online class of Chinese Medicine Gerontology. Today, we study the second part of coronary atherosclerotic heart disease. Focus on learning the central differentiation treatment of coronary heart disease. The dialectical key points of coronary heart disease are the following three aspects. The location of the pain is limited to the thoracic diaphragm, or most of the precardiac area, mostly stagnation or blood stasis radiating to the shoulder, throat, abdominal cavity, and even the arms. Identify the nature of the pain. The disease is slower in wake type. The pain is continuous or vague and wanted to be wrapped and pressed. The pain is more severe in true type. The pain is light in chi stagnation type. The pain is like acupuncture in blood coagulation type. The pain has a fixed place and refuses to press, especially at night. Identify the degree of the pain. The duration of pain is mostly short, and the number of pain episodes is generally proportional to the severity of the disease. That is, the occasional is light and the frequent is heavy. However, there are also cases where the number of episodes is not large, and the condition is serious, and the clinical manifestations must be combined with specific analysis and judgment. If the pain is caused by work, the rest can be relieved after taking medicine. There is no obvious cause for the onset of pain. Those who have poor rest or medication effects are more seriously ill and may worsen to true pain. They should be actively treated. TCM central differentiation therapy has a significant effect on improving the clinical symptoms of elderly coronary heart disease and reducing the time and frequency of pain attacks. In the specific classification treatment, according to the difference in the weight of the disease and the deficiency of incense, it can be roughly divided into syndromes of heart blood stasis syndrome, cold coagulation heart path syndrome, phlegm internal obstruction syndrome, Qi deficiency and blood stasis syndrome, heart kidney yang deficiency syndrome, and other syndromes can effectively guide clinical. Let's take a look at the specific differentiation of governance. First, the main points of central differentiation for each central type. One is to grasp the characteristics of main symptoms. Chest tightness and chest pain are the main symptoms and signs, but the manifestation of each central type is different. The focus is different, and the severity is different. If the heart and blood stasis syndrome, the cardiothoracic pain is severe, such as thorns and strangulation, the pain is fixed. The cold coagulation cardiopulmonary syndrome is a sudden heartache, such as strangulation, or the heartache is through the back. The backache is through the heart, and the cold is worse. The phlegm and internal resistance syndrome chest tightness is heavy and the heartache is light. Second is to grasp the characteristics of the syndrome and determine the central types through the syndrome. For example, in addition to the performance of phlegm and phlegm, the performance of the lung and spleen Qi deficiency and tongue and veins. Qi deficiency and blood stasis are accompanied by shortness of heart, palpitations, shortness of breath, fatigue, and embolism. Heart kidney yang deficiency syndrome is accompanied by heart palpitations, spontaneous sweating, and even worse movements, tidiness and shyness, pale complexion, limb hypothermia, embolism. The third is to grasp the factors that relieve the aggravation. For example, the syndrome of heart and blood stenosis is often aggravated by poor mood. The cardiovascular syndrome of cold coagulation is aggravated by cold. The syndrome of phlegm and turbidity is aggravated by railing days. The syndrome of Qi deficiency and blood stenosis is aggravated by fatigue. It is worth noting that heart-blood stenosis is often accompanied by other syndromes throughout the onset of chest tightness. Governance. In view of the pathogenesis of this disease, it is based on the fact that the virtual reality is mixed, the combination of the virtual reality and the reality. It's more than enough. When the pain occurs, treatment such as fragrant warmth, promoting blood circulation and removing blood stenosis, 宣臂通阳, flame and resuscitation are used to quickly relieve the pain and prevent the syndrome from changing. In the remission period, the deficiency should be supplemented, but we should still pay attention to promoting blood circulation, regulating qi, and reduce flame. Since the blood circulation of the heart and veins is fluently, the pain disappears, so the method of activating blood to resolve stagnation of collaterals can be used in different treatments based on different syndromes. Because the disease is a mixture of falseness and reality, it is necessary to make up for the deficiency and forget the evil. Exorcise the evil and forget the true and false. Weigh the amount of the false and true of the specimen, and examine the appropriateness of the method of supplementing and purging. For the treatment of true heartache, it is necessary to distinguish the seriousness of the syndrome and the success and the failure of the syndrome. Once the harbinger of the syndrome is found, the product of yi qi, 固脱, must be administered as soon as possible, or the treatment integrated Chinese and Western medicine. Representative prescription and the addiction and subtraction of medication. Master the key prescriptions. The first is 血府逐瘀 decoction. This prescription is a well-known prescription for the treatment of heart and blood stenosis syndrome. The second is 瓜蒌蟹柏 cereus decoction. There are 3 prescriptions for 仲景, and their treatments are suitable for each. According to the composition of the medical prescription, the functions of the prescriptions and the syndromes of the patient are analyzed. 瓜蒌蟹柏半夏 decoction for coronary heart disease. 枳实蟹柏桂枝 decoction for treating Qi blood flame type coronary heart disease. The third is 补阳还武 decoction. This recipe is a classic recipe for Qi deficiency and blood stenosis, and must be mastered. The fourth is 胜负 decoction and 桂枝甘草 decoction. It is composed of 人参、附片、桂枝、甘草, etc. 人参 nourishes vitality. 附子 warms and strengthens yang. 桂枝 and 甘草 reinforce yang. 山茱萸鲜柠皮补骨脂 warm kidney to help yang. It is effective for patients with heart and kidney yang deficiency in remission period. At the same time, you need to pay attention to the following points when you apply for a certificate. The pathogenesis of chest pain is based on a force. Clinical treatment should take tone as a supplement and combine with supplement. The tone method includes aroma warming method, 宣臂通阳 method, promoting blood circulation and removing blood stenosis method, and the Bu method include supplementing qi and blood method. Warming kidney and nourishing kidney in. The method of promoting blood circulation and removing blood stresses run all the time, but the chest pain recurs repeatedly. The course of disease is long, and most of them are mixed syndromes. In clinical treatment, it is necessary to pay attention to the compatibility of supplementing qi, nourishing yin, resolving flame, and regulating qi products on the basis of promoting blood circulation and removing blood stresses. Blood-breaking products are easy to hurt and upright, and should be used with caution. Use aromatic warmth medicine with caution. Cold valve internal closure is one of the important pathogenes of the thoracic pain. Attention should be paid to the use of aromatic traditional Chinese medicines that are fragrant and warm. During clinical treatment, aromatic Wen-tong drugs should be combined with warming yang qi agent. Because of the spicing fragrance of warm and fragrant products, the disease will stop immediately and avoid yang damage. Clever use of qi-resolving flame method, flame turbidity, is closely related to chest pain and related to susceptibility factors. At the time of treatment, spleen and stomach should be strengthened, and spleen and qi invigorating products should be added on the basis of expectoration to eliminate flame. Note that the amount of qi supplement should not be too much. That's all for today's lesson. Thank you all.